Hi, my name is Joe Mazzella, and we're going to be talking about the Cri-Du-Chat syndrome. So, what is Cri-Du-Chat? Cri-Du-Chat syndrome is also known as the 5P syndrome or the cat-cry syndrome. It's a rare genetic condition that is caused by the deletion of the genetic material on the small arm of chromosome 5. It is unknown as to why this chromosome is deleted. The prevalence of this disability is 1 in every 37,000 to 50,000 people are affected. So the causes of Cri-Du-Chat, as I mentioned, they're caused by a deletion of chromosome 5. The size of the deletion varies among all of the individuals, but research shows that it is suggested that larger deletions tend to result in more severe disabilities and developmental delays than the smaller deletions. The signs and symptoms of Cri-Du-Chat syndrome are probably related to the loss of multiple genes on the short arm of chromosome 5. So I was actually interested to know if this was genetically inherited. It is not genetically inherited, as the chromosomal deletion usually occurs at a random event during the reproductive cells. People that are diagnosed with Cri-Du-Chat typically have no history of the condition in their family. So the symptoms of this disability stem from the sound of a cat-like cry. They will experience extreme cognitive delays, delayed development, and such. But the main symptoms that people can pick up on are their head size, the low birth weight, the low muscle tone. There are some visual things there, but the language is also a big thing. But the Cri-Du-Cat name comes from the high-pitched cat-like cry. So some of the behavioral characteristics that you'll see are the adaptive living skills, their communication, the mood, hyperactivity or impulsivity, repetitive behavior, sleep, social skills, and behavioral difficulties. The diagnosis of Cri-Du-Chat syndrome is generally made in the hospital, or a healthcare provider can note the clinical symptoms. A cat-like cry is the most prominent feature, though. That's the giveaway for this disability. But you can also use the FISH analysis to reveal the deletion of chromosome 5. So for treatments, there are no specific treatments for the Cri-Du-Chat syndrome. The only thing that we can really hope for is to give the full the supports and assistance to help people with Cri-Du-Chat reach their full potential and get the most out of the situation. But there is no specific treatment at this time. Daily supports. We would support anybody who's diagnosed with Cri-Du-Chat syndrome as we would with anybody with an intellectual disability who struggles with cognitive, speech, hearing, any of those things. So we would use the physiotherapy, speech therapy, communication alternatives involving sign language and such. We would use occupational therapy and things that go in correlation with coping strategies and a new skill. Supports for parents. Research shows that counseling, new information, advocacy, and support groups are a big help to parents who have children who have had their children diagnosed of Cri-Du-Chat syndrome. In the educational background, as teachers and educators, we would want to make sure that we're constantly informing the family, supporting the family, and that we involve the family and ask for participation in the educational setting, in the district setting. For academic supports and services, someone who is diagnosed with Cri-Du-Chat syndrome would be probably referred to a self-contained academic setting and more of a life skills program. Students who have the Cri-Du-Chat syndrome would probably benefit from the preferential seating and obviously an IEP. After speaking with many coworkers who work in the self-contained setting with students who are lower functioning and have cognitive struggles, they have never had a student with this disability before, but they would correlate it to somebody in a self-contained setting. So we would utilize the one-on-one aid, occupational therapy, physical therapy, speech counseling, and assistive technology for reading and writing to make sure that we're getting the most out of them academically and making sure that they're in their least restrictive environment. So yeah, that's Cri-Du-Chat syndrome.